Good afternoon, ladies and gentlemen. Bernard Harris here with the Pikes Peak Strategic Group and the AmeriPlan Corporation. Everybody knows what's going on in our world today, but I want to specifically talk to folks that live in rural areas. Ladies and gentlemen, we are here. We have been here. But we have something that's going to give you and your entire household some comfort and kind of take away the anxiety of wondering what should I do with regard to overall health care. Our Deluxe Plus plan is going to cover that for your household. Folks, even if you do have insurance, you don't have, for the most part, a lot of rural areas don't have access to a hospital that you can get to within a short period of time. What if I told you that we have, and again, have had a program called telemedicine that will allow you to reach out to a licensed physician in the state where you make the call. Okay, this has been around for a while. We know it works. And I'm going to give you two hints. If the doctor that you speak to prescribes a medication, it is a $25 call. If he or she just answers a question and then you guys hang up, it's free. Now, I'm not going to make any disparaging comments about what the government is doing. I think it's great, actually. But once this epidemic or pandemic is over, that particular program goes away. When you're dealing with the government, and most of you know, it don't last forever. With us, as long as you are a member, you're going to have this program. And another hint, if you travel anywhere within the 50 United States of our country, you're going to have access to this tremendous benefit called telemedicine, 24 hours, 7 days a week. I'm going to have my partner, Mr. Ed Harrison, chime in. Ed, what do you think about that?
Well, I tell you, it's a tremendous program. The telemedicine program has been around for a number of years, and private insurance companies have had it for the last 3 or 4 years, but it gets a little expensive depending on what type of insurance you may have. I think at a minimum it's $40, $50, or $60 just to call up a doctor and get advice through a Blue Cross or a Kaiser or one of those other private insurance companies. With our telemedicine program for entire household for $39.95, and our lesser program at $24.95 a month for your entire household, we're talking about a membership program whereby you can talk to a licensed physician in all 50 states and get some recommendations on what's going on with you with regard to the virus that we're dealing with, the coronavirus, or any other type of ailment you may have in your family. And in particular, I think Bernard was talking about those are military people who are transitioning out of the military, and those farmers that are out in the middle of nowhere, and they may be held down by bad weather, inclement weather, or in a lot of these rural areas across our great country, they're losing their hospitals out in that area, and they cannot get to an emergency room. So if that was necessary. So what we're offering strictly for information for us to give us a call is our telemedicine program, which is a membership program which you can sign up today and virtually use today. If it's early enough in the day, we can sign you up as a membership. There's no contracts, nothing of it. It's a month-to-month program. One of my colleagues, myself, Bill Gamble, or Bernard Harris will be happy to speak to you about the ins and outs of the program, how it works, how it complements our HIPAA regulations, that is the confidentiality between the doctor and the patient. So when you're speaking to this particular doctor, everything you say is confidential. He or she will have to get some basic information up front so they can diagnose your problem. And once again, if it's strictly consultation, that call is free. But if they do some type of diagnosis and analysis and they have to send a prescription maybe to the local Walmart or Walgreens, that would be $25 which you would pay. But this is a fantastic program. It's something that you can use right away. As I mentioned in earlier video that we talked about this morning on March the 17th, the federal government announced a new program through Medicare called MedHelp. And they said that's going to be similar to our program. But you know how bureaucracy goes with the federal government. They say things are going to start in a few weeks, and it may not start for 4 weeks or 6 weeks. In the meantime, we are in a crisis in this country, and people are fearful. They're storming the stores for toilet paper and all kinds of crazy things out there, and they are frightened. So people want to talk to the professionals, and you can do this from the comfort of your home, because most of us, I'm a senior, so I'm hunkered down. They've asked me to stay at home, so my wife and I are, unless we have to go out to get some, some groceries or something. But we're staying close to home, and the kids are all out of school with the parents and so forth. And with this program, telemedicine through AmeriPlan and the Pikes Peak Strategic Group, you can talk to a licensed physician and get information right away. So with that being said, I want to direct you to the bottom of this video. Give us a call at our 1-800 number. One of my other two colleagues or myself will be happy to speak with you, and we hope you have a safe day. Give us a call. Thank you very much.